Hi, my name is Dr. Kathleen Jude Estime, psychiatric mental health nurse practitioner, and today we're going to talk about shock. So, shock is a life-threatening condition where the body is not adequately perfusing tissue with oxygenated blood, leading to a cellular dysfunction and potential organ failure. So the patho behind shock is decreased cardiac output, low blood volume, or widespread vasodilation, which can lead to inadequate tissue perfusion. Among the types of shock, we have hypovolemic shock, which is actually the most common type of shock that you'll see as a nurse. We also have cardiogenic shock, which involves the heart, and we have distributive shock, which is caused by widespread of vasodilation. And under distributive shock, you'll see anaphylactic shock, septic shock, and neurogenic shock. There's 3 stages of shock. First, you have the compensatory stage, where the body attempts to maintain blood pressure through mechanisms like increased heart rate, vasoconstriction, and renal retention of fluids. Then we have the progressive stage, where the compensatory mechanisms fail, leading to further decrease in blood pressure, rapid breathing, altered mental status. Then we have the refractory stage, where we have irreversible tissue damage and multiple organ dysfunction syndrome, which is called MODS, often leading to death if not treated promptly. The clinical manifestations of shock, you'll see tachycardia, hypotension, cool, clammy skin, pale skin color, rapid, shallow respiration, decreased urine output, anxiety, confusion, and restlessness. The diagnosis of cytokines release syndrome can also lead to shock. Clinical presentation is an elevated levels of inflammatory cytokines. You'll see an increase of cytokine blood tests, acute phase of reactant like C-reactive proteins, CRPs. You also want to know the differences between the late and early stages of shock. In the early stages of shock, you're going to see changes in behavior, anxiety, restlessness, confusion, and agitation. For the vital signs, you're going to be slightly elevated heart rate, rapid respirations, slightly elevated blood pressure, and skin appearance is going to be cool, clammy, and pallor. You might also see thirst, nausea, weakness, and rapid pulse. In the late signs of shock, you're going to see altered mental status. Cardiovascularly, you're going to see marked a very low blood pressure, weak pulse, irregular heart rate. You're going to see a decrease in urinary output and dark urine. So for your nursing interventions, you're going to want to do an immediate assessment. You're also going to follow ABCs, the airway, breathing, and circulation. You're also going to want fluid resuscitation. So you're going to administer IV to restore circulating volume of hypovolemic shock. You're also going to want to use oxygen therapy. You're going to want to provide oxygenation to provide oxygen to improve tissue oxygenation. In terms of medication, it depends on the type of shock. Depending on the type of shock, you want to administer vasopressors and other medications to improve cardiac output. You want to monitor vital signs. Closely monitor blood pressure, heart rate, respiratory rate, and urine output. Treat the underlying cause. Address the primary cause of the shock, such as controlling bleeding or managing sepsis. Thank you for watching. I hope today you learned a lot about shock. Please like and subscribe. And if you have any questions, please drop the questions in the comment box and I will address each question.